Hi guys, again this is Dr. Bhupesh. Please subscribe our channel if you have not. Our contact number is 769673425 for the best OET coaching, recording the third question of the day for you. That is the 12th question. Again, thanks to OET for creating this question paper. My job being Dr. BKM is to tell you how to do it. What point about the patient safety is the writer making by quoting Dixon Wood's comparison with the climate change? Now, this is the question you might do in the second round. Why? Because the question itself is difficult. Never do difficult questions in the first round. But we will go through this question once. Like this question was very easy. We have just recorded. And this question seems like a big question. If you do not understand, do it in the second round. But at least try to do it once. Try it once. What point about the patient safety? So the main word is patient safety. Writer wants to know about what is the main point about the patient safety. That is the writer want to make by quoting Dixon Wood's comparison with the climate change. So again, patient safety seems like a seems like an issue that patient is safe or not. So patient Dixon Wood's comparison with climate change. Let's see what is the comparison. Then only we will get to know about this question. Dixon Woods compares the issue of the patient safety to the climate change in the sense that it is a problem of many hands. Many hands means multiple hands. Multiple hand means numerous. Numerous means involving many people. So that means they are saying, Dixon Wood is saying that patient safety is like handling the climate. There are various reasons because many people are involved with many factors, each making a contribution towards the outcome. Outcome means result, finding. So that means the final result, whatever comes out of the patient safety, is because of due to multiple reason. Because doctor is involved, nurses are involved, healthcare workers are involved. That means one patient goes through many hands. So that is why patient safety is such a difficult issue, because everybody works differently, and there is difficulty in identifying where the responsibility of the problem of solving the problem lies. And you cannot understand whether it is doctor fault, it is nurse fault, it is healthcare, who is at fault. So it is a problem which is complex because of many hands. Many patient safety issues arise at the level of system as a whole, and many patient safety issues are due to the complete system. Complete system means complete hospital or maybe the complete government. But policies treat patient safety as an issue for individual organization. But the problem is that we treat patient as safety as an issue of individual organization, that this hospital is good, here patient safety is more, here patient safety is less. But Dixon Wood wants to say that it is a problem that is of the whole system. Organizations should not be blamed. Let me read again. Many patient safety issues arise at the level of system as a whole. So she is saying it is the complete system. But the problem of the policies is that it treats patient safety as an issue for individual organization. So that means Dixon Wood is comparing the patient safety with the climate and saying that it is a problem of multiple hands. That means you do not know who is responsible, and it should be taken as a complete system. Let's see. What point the problem will worsen if it is not dealt soon. There was no, again please note these important words like soon. There is no words that says promptly, that says soon, that says fast, that says early. So there was no word like soon. You can eliminate this option. This is elimination method. It is not clear who ought to be tackling the situation. We do not know who is responsible. So this can be the answer. It is hard to know what the best course of action is. Now this is confusing. But best word was not there, and course of action I think was not there. The main thing was who is responsible. So again, I would prefer B out of A, B, and C. D. Many people refuse to acknowledge. They were not talking. Acknowledge means, suppose if I send you an email and you tell me yes I have received it, it is acknowledgement. Acknowledgement does not mean reply. Acknowledgement only means that you have received. So you are bringing to my knowledge. This is the word coming from knowledge. So many people refuse to acknowledge that was not saying that people do not accept. So people were not refusing. They were not saying that it will get worsen. They were not saying that it is hard to know what is the best. This can be the answer. I'm confused between B and C. It is hard to know what the best course of action is, but course of action I was not there. I think was not there. Let me try again. The best course of action, I'm little confused. Compared to safety issue, it is the sense there is a problem of many and each making a contribution difficulty in where that is the main line who ought to be. Many patient safety arise at the level of system as a whole, but they were not talking about any solution. So, and course of action means a solution. So the paragraph is pretty negative, like this option is negative, but C option is positive, so it should not be my answer, but I'm not 100% sure. So this is a kind of a question I would like to do in the second round, but this is it in the final exam. I would not like to do more than this. This is where I stop. This is my last. Like, you do not read it again and again to waste your time in the first round. So if you understand this, then you do it, otherwise you leave this question. Now I would like to ask you all whether this question is right. The last two question I was sure were right. This question I'm not sure whether it is right or wrong, so I will like to have your participation if you can help me. B or C? B was the answer,
B,
guys.
sir.
B.
B, sir.
And you
B is answer.
got this point just by understanding that this paragraph was talking about problems. That last line also was saying it is the problem of whole system. They were not talking about solution, and best course of action means solution. So best word was not given, course of action was not given, then it becomes an easy question if you use the elimination method. Soon word was not given. So please understand these words. That is the main words I tell you. Soon, fast, early, slow, gradually, only, exclusively. These different words are supposed to be taken care of. This is Dr. Bhupesh from Dr. BKM Institutes. Again, please subscribe our channel if you have not. Thank you.